Good morning, Ms. De Niro. I'm your student nurse today, and I'm going to talk to you about the medication your doctor prescribed to you before you go home. So, you've been prescribed phenelzine, which is a monoamine oxidase inhibitor, or an MAOI, and this will be used to treat your depression. This medication overall has great efficacy, meaning it works really well. We don't use it as frequently. However, you have tried multiple depression meds and those didn't work. So we put you in that refractory depression category, which is totally fine. We have many medications that work with refractory depression. It's just important to note that. Another reason we're giving you this medication is that you presented to us with atypical depression. And atypical depression is a type of depression in which the symptoms stray from the traditional diagnostic criteria. So just a little more in depth, it is a type of depression in which you can experience a temporary boost in your mood in response to a positive event, whereas typical depression does not. So this is the best medication for that atypical and refractory depression. So a little information about this medication. It is an MAO inhibitor, and the MAO enzyme in your liver deactivates norepinephrine, serotonin, and dopamine. And those are neurotransmitters that give you that, for lack of better words, that happy sensation and kind of help balance out your moods. So by inhibiting that enzyme, you'll be getting more epinephrine, serotonin, and dopamine available at your nerve endings for your brain and body to use to help manage your depression. So there are some serious side effects that I would like you to be aware of. There is CNS stimulation, so you could feel on edge a lot of the time. You could get orthostatic hypotension, so just make sure, again, you're drinking plenty of fluids. Make sure, maybe consider wearing compression socks if you experience this side effect, or just contact your doctor who can give you some more in-depth. Phenelzine reacts strongly with food, so it has a lot of drug-food interactions, and specifically with tyramine. And it gives you, if you eat foods with tyramine, this drug could react with the tyramine and give you a hypertensive crisis, which can potentially lead to stroke and comas. Again, now I know that sounds crazy, but I will tell you the foods that you need to avoid with tyramine in them. So you'll want to avoid aged cheese, smoked meats, yeast, and red wine. Oh, you're a Chardonnay drinker. You're totally fine. I know that sounds like a lot, but again, it is definitely manageable. So again, before I say my goodbyes, I just want to double check a few things. Are you on any antihypertensive medications or medications to lower your blood pressure? Great. Are you taking an SSRI or a TCA depression medication right now? Wonderful. Are you taking ephedrine? Are you taking meperidine for pain? Awesome. Okay, great. Just remember to always ask your doctor before you go on any more medications, as they can react strongly with phenelzine. Thank you. I hope you have a great rest of your day.